Hello, everyone, and welcome to a quick video edition of PeachPod, a Georgia politics podcast. My name is Kyle Hayes, and I am your host. And joining me on this quick video PeachPod is Ted Terry, the former mayor of Clarkston, Georgia. Ted, thanks for coming on the podcast.
Thank you very much, Kyle. Hope everyone is healthy and well in your household.
Yeah, I hope so for you too as well. You're joining us today at a really serious time for people in DeKalb County, in Georgia, and across the entire country. So we're here today to talk a little bit about local government response to the spread of COVID-19 or the coronavirus. Ted, you recently ended your tenure as mayor of Clarkston, Georgia. You still serve on the DeKalb County Board of Health. Can you tell us a little bit about the concerns that your constituents are sharing with you in these really tough times?
Absolutely, yes. And so I've been on the DeKalb Board of Health for the last 6 years now. I am not a public health expert, but I have a lot of communication and contacts with doctors, medical professionals, people in the public health arena here in DeKalb, and really just around the region. Been hearing first from one of my fellow board members, Dr. Kamara Jones, who is actually the city of Atlanta's representative on the DeKalb Board of Health. She expressed concern at the emergency DeKalb Board of Health emergency meeting on Tuesday, where we formally adopted and approved the declaration of emergency coming out of the CEO's office. And so after we did that, Dr. Jones do more. She thinks that we, looking at the people that she's been talking to, and Dr. Jones actually is the past president of the American Public Health Association, the national organization. So a really smart, well-connected healthcare professional, public health advocate, saying, look, we need to look into. I was at the meeting and I agreed with her, and speaking with her afterwards, we discussed how the point of the Board of Health in any county, every county has, community members, elected officials that serve on this role to oversee the public health of their county. And, the way we view our role is to be advocates for the health care and the health and welfare of all 750,000 DeKalb residents. And so we worked on this letter that sort of outlines a stronger lockdown approach than the one that is currently being deployed here in unincorporated DeKalb, as well as sort of state order.
Yeah. So you put together this letter calling for a stronger lockdown. Can you explain for us the difference between the current lockdown that's been put in place in DeKalb County and the stronger lockdown that you're calling for?
Well, the main sticking point and at any gathering of more than two people is potentially continuing the spread of the coronavirus. That is what the public health experts are saying. When they say social distancing, physical distancing, they're not just saying, once in a while. It literally, the recommendation is, now, as part of your life. And, we're hearing stories coming from restaurants and saying that people aren't taking it seriously. The Atlanta Journal-Constitution reported about a local pizza place, nearby who, is just saying we're actually closing for takeouts because some customers aren't treating it seriously and they're joking around and putting the health of their workers at risk. So part of it is just acknowledging that, one, this is a serious situation. We want everyone to take it very seriously, and if we all take it seriously and do our part, we actually can get through this together with as minimal and economic, recession as we possibly can. And in particular, one constituent that reached out to me works at a small gym. Her boss is telling her she's coming to work, next week, and they're going to get around the 10-person rule by just having classes of 8, one coach and one front desk clerk. So basically what that's saying is that there are potential loopholes where people can continue to gather, continue to, do things that are basically, potentially, helping the spread of coronavirus. Where the goal of a strong lockdown is to immediately cut off as much potential risk for spreading as possible. That has been the most effective solutions we've seen thus far.
So, in recent days, there has been this increasing debate about whether closing down businesses and forcing people to stay home to slow the spread of the coronavirus, whether that's sort of worth the economic cost of taking those measures. We did see record setting unemployment claims last week, and we're expected to see even higher numbers going forward. But there also have been stories from hard hit hospitals, from hotspots where coronavirus has spread rapidly, that hospitals don't have the capacity to provide treatment for all the people that are coming in to see them. So what is your message to people who would want the economy to basically reopen more quickly?
Yeah, absolutely. And I think what we've outlined in our letter, and based on I think the research and data that's out there, as of Friday at 3 p.m., 3:30 p.m., is that the countries and the communities that have taken the soft approach that we're currently in right now did so because they wanted to keep the economy going. But as the healthcare systems, as ICU and emergency room capacity was filled, they realized that they had to go to hard lockdown. So what I'm hearing from public health professionals is it's not a matter of if we should do this stronger lockdown. It's a matter of when we're actually going to do it. And the argument that I'm making is that if we want the economy to have the least amount of impact, then we have to act as soon as possible. We have to all get through this together because we will recover faster if we bend the curve down sooner. That's just basically what it comes down to is when the economy reopens, we want that curve to be bent back in the other direction, and seeing a decline in cases, a decline in deaths.
So you're pushing for action at the local level in DeKalb County, but the governor could obviously take statewide action here as well. At a town hall earlier this week, Governor Kemp defended his decision not to issue a statewide shelter-in-place order. He said basically that he was trying to balance the interests of some communities, like in Atlanta or down in Albany, that have high coronavirus rate cases in those communities, balance those interests against the economic interests in some counties that don't have any cases at all, at least no reported cases yet. Do you believe that the governor should step in and issue a statewide shelter-in-place order?
Well, absolutely. I think that is what the evidence is proving to be the most effective solution. And, we have a lot of legislators who have asked for that very thing. And, I was actually, on Twitter this morning, and I was reminded that Representative B. Wynn from here in DeKalb County, 2 weeks ago, about 15 days ago, was calling for stronger action to take place. And I think it's just really important. I mean, this is, unfortunately, this has become kind of a political issue. And, what I would hope, and I think that most Georgians expect is leadership and to do what is going to be the best for the state, for not just the short term, but also the medium and long term future, of our people, of our vulnerable populations. And so, in absence of state action, as you pointed out, the governor has said we'll let the local jurisdictions decide. And this is what this is about. Is let's realize that Atlanta has done stronger measures. They're not an island. Decatur, Brookhaven, Doraville, Avondale Estates, Clarkston is tonight. So more and more cities in DeKalb are adopting this. We're not islands. We can't put walls up around our communities. We understand that, even in the essential services area, and even under the soft lockdown, there's still, commerce happening. And, unfortunately, we're going to have to take a region-wide approach. And so I'm hoping that DeKalb County, all of DeKalb, cities, county, everything moves to the stronger approach. And then we get the rest of the metro regions, the other 90 plus municipalities, the 13 counties. And, look, if we begin to, try to make changes at the local level, I hope that will actually encourage the governor to take action at the state level. A lot of times change comes from the bottom up. And at this point, it seems that is our only option for trying to save as many lives as possible right now.
So for people locally in DeKalb County who want to see this change happen in their communities, who want stronger measures taken by their local officials, how can they let their local officials know that they want to see those changes made?
Well, absolutely. I think it's just a matter of emailing and reaching out to your, whether it's a city council member, mayor, county commissioner, even school board members. I mean, why not? I mean, anyone who had public health officials, the DeKalb Board of Health. I'm on there. I think it's just there's a lot of leaders in our community, and we have a lot of overlapping jurisdictions. We have state house members, state senators. So this is just something I think we have to raise the collective consciousness of. We want people to be asking the question is, are we doing enough? And so right now, the important thing for any DeKalb resident to do is to ask that question of their elected officials and other leaders. Are we doing enough? We want you to look at this. And in our letter, we argue that more should be done. And so this is hopefully an opportunity for folks to realize the urgency of the situation, to take leadership. We have a lot of leaders that have already stepped up. And at the end of the day, this is not about trying to leader. It's about just trying to act in the best way possible. What the evidence, what the public health and the medical professions say is the best course for action to get through this pandemic with as many lives saved as possible.
All right, Ted. Well, we really appreciate you taking a few minutes. Before we go today, is there anything else our listeners should know about this situation in your community or in the state?
No, I just want to appreciate everyone who has been staying home, who's been leading by example. Continue to encourage people to only go out for essential items and services, and certainly, even though it says stay at home, get out and get some exercise, get some fresh air, obviously within the social distancing. And please, everyone, stay healthy and safe out there. And we'll look forward to seeing everyone in person really soon, hopefully sooner than later.
All right, Ted. Well, thank you so much for taking a few minutes. We hope you and your family are staying safe as well, and we will talk to you again soon.
Thank you, Kyle.